Good morning, students. Today we will learn about the National Health Program related to maternal and child health. In that, we will include different kind of the program related to the mothers and baby. Okay, so both health are very essential and important during the postpartum period and whole life. So that's why we will include it into the in this topic different kind of the programs run through the government. First of all, maternal and child health program, which is consist of the mothers and child health care. Okay, so in that milestone development of the MCH care, that is maternal and child health care, in 1886 establishment of the training of the dayas. We already know that in previous time, that is the dayas are for the care of the mother and especially for the baby, newborn baby. So the establishment of the training that in developing into the 1886. Then in 1902, first midwifery act for safe delivery. A act is given for the specially midwifery nurse for giving and taking care of the delivery. Okay. In 1952, that is a family planning program is arise, which is uh, run by the government also and helpful for the couple who have that maintain that family. Okay, so for better planning of the family, that program run is the family planning program. Then in 1978 expanded program on immunization, obviously because after the delivery of the newborn baby, the care of newborn baby is very important and essential. So in that case, the immunization program was conducted by the government. Okay. So in that immunization schedule, whole vaccination of vaccination for different kind of the disease prevention. For that purpose, the immunization vaccine is given to the newborn baby till 5 years. Okay. So in 1985, Universal Immunization Program also developed, and in 1992, Child Survival and Safe Motherhood Program. Okay, in the Child Survival and Safe Motherhood, both the mother and baby's care are given, and for main purpose of the safety of the mother and baby. So we can prevent the morbidity and mortality of the both maternal and child. Then in 1997, RCH program phase 1 is developed. Okay. So RCH, reproductive child health of the mother, reproductive child health. So in that, after the period of the postpartum and in whole reproductive phase and delivery of the baby, both care are given into the phase 1, and 2005 RCH program phase 2 was developed. Next, 2005 National Rural Health Mission. So in rural area, whole kind of the health of the mother and baby are very important and essential. So in that case, rural area also get developed by the program, that is National Rural Health Mission. In 2013, RMNCH plus A strategy is developed, and in 2013 National Health Mission also developed. Okay, so National Health Mission also whole program has a same purpose, because the development of the mother and baby's health and safety purpose. And in 2014 India Newborn Action Plan was developed. So what kind of the trends occurs and changing in the trends in the maternal and child health care, we will learn about that. That is the first of all, we already learned that family planning is most needed and in MCH care, because due to that care, mother have benefit of the whole reproductive phase and whole mother health. If family planning is not maintained, then mother have to suffer many kind of the problems as well as baby also. Okay, so family planning and MCH care are integrated. Then provision of the emergency obstetric care in first referral unit. Okay, so that is the unit run by, it run in any hospital and organization, that is the first referral unit. In that, special emergency care provided to the mother in obstetric care, means whole kind of the pregnancy care is emergency given into the mother. Then train local dayas who are trained into this kind of the organization. So next one is the child survival and safe motherhood. As I told earlier in this program, the both mother and baby health care and safety is most important. So this program was launched in 1992. Objective of this program that is reduce the infant mortality rate, okay, then maternal mortality rate and children mortality rate, okay. So by 1000 live birth, 60 in infant mortality rate, 60 upon 1000 live birth means 1000 population of the infant, that 60% infant are dead. So this kind of the ratio is very high. So in that case, the main aim of the CSSM program is to reduce the rate of the infant mortality rate, maternal mortality rate and child mortality rate. Okay. So strategies are: first, referral units for emergency and essential obstetric care, that is training of the dayas, operation theatre. In operation theatre, double set of OT were prepared. Okay. So in emergency cases, if mother having complaint of the pain or true labor pain, that in that case normal vaginal delivery and cesarean section both setup are prepared by the doctors, and proper well equipments are there, then emergency services provided to the newborn or children, because if a newborn is delivered by low birth weight or any respiratory tract infection or suctioning problem, then in that case emergency services are needed. So previously doctor prepared this kind of the setup in their clinic or hospital. Then conversation of the village level immunization section into the maternal and child protection section, because we already know that many kind of the disease are developed nowadays. So in that case maternal and child protection are very important. Okay. So all kind of the vaccination is given into the immunization schedule till the 5 year of the children. Then training of the dayas, delivery kit are provided at 100,000 rupees per reported case. Okay. So if mother reported that case, then by giving 1000 rupees, delivery kits are given to the mother. Then drugs and equipments for the MCH care at the subcenter. Not only whole program are not run through the government, but whole services are provided to the CHC center, PHC center, sub-center, etc. Okay. So drugs and equipments for the MCH care at sub-center. Then health education given to the mother as well as the family also, and training of the health personnel. So what kind of the intervention occurs in the CSSM program? So in for the child survival, essential newborn care is must needed, because we already know that in some cases or due to some financial problem or any other reason, family or mother can't proper observe to the newborn or proper care to the newborn baby. So in that case, essential newborn care is a very important. Then immunization of the children till 5 years of age. Then management of the acute respiratory tract infection and diarrhea, because in these two kind of the condition, newborn have to suffer many problems. Okay. Feel lethargic and weakness, and he or she can't stable anymore. So in that case, particular management of given especially this kind of the disease, and vitamin A prophylaxis. These all are care given to the child survival and child safety. And next one for the mother. So for the safe motherhood, immunization common into the mother and child for the pregnant woman. Then prevention of the and treatment of the anemia, because due to the deficiency of the anemia, not only women suffer but also fetus or newborn baby also suffer due to this kind of the problem, like low birth weight baby, neural tube defect may occur. So this kind of the high risk to the baby also. Then antenatal care is proper given to the mother, because in antenatal phase we are not observe or proper care to the mother, then definitely chances or risk for the baby also. So in that case, proper antenatal care and education is given to the mother and family members also. Then institutional delivery, managing the obstetric emergency, because if any cases mother having some high risk pregnancy, or is if any problem already mother have, then we already priorly manage to that kind of the problem, describe to the doctor, and doctor try to manage or control that kind of the disease or high risk pregnancy. So managing that kind of the obstetric emergency and the birth spacing. Okay, so these all are description and care or services given to the child survival and safe motherhood, CSSM program. Okay, next one, the reproductive and child health program. Okay, so what are the reproductive and child health program? The objective of this program is to meet all needs of the contraception, all kind of the needs given provided into the contraception, then to reduce the infant mortality rate by 1/3 and maternal mortality rate by 1.5. Okay, so ratio are given for the reducing of the infant mortality rate and for the maternal mortality rate. So mortality and morbidity both rate are reduced. That this is main objective of this reproductive child health program. Okay, so this program is divided into two, that is phase 1 and phase 2. As I told earlier, in phase 1 we will include that aims. What are the aims of this phase 1? That is to reduce birth rate below 21 per 1000 population. Okay, so reduce birth rate of that population, then reduce maternal morbidity and mortality rate, reduce infant mortality morbidity rate, 80% of the institutional delivery occurs and proper care in given into that delivery, then 100% of the antenatal care and immunization of the children. So basically, you know that whole program has the same intention and aims, that is for child and mother safety and survival, and reduce the death rate and disease rate of the mother and infant both. Because if we can't prevent that, then we can't proper care or proper care given to the children and as well as the mother also. So all program has the same aims and intention similar, that is the infant mortality morbidity rate. Okay, so etc. And major intervention of this program, that is essential obstetric care is given. Registration of the pregnancy is earlier registered, okay, by mother or family members. Then minimum 3 antenatal checkups are done into the whole pregnancy. Okay, then safe delivery in home or institution, and minimum 3 postnatal checkups also done. So 3 antenatal checkups and 3 postnatal checkups done throughout the pregnancy. Then emergency obstetric care in that double setup of OT, normal vaginal delivery and for the cesarean section. Then all equipments and emergency drugs given for the mother. So this kind of the setup done by the specially doctor and surgical doctors, okay, and skilled manpower at the host referral unit also. In that, 24-hour delivery services at the PHC center available, additional honorarium to the staff. Okay, so the dignity and professionalism also maintained for the staff, not only for the whole doctors also, but for staff also, that kind of the environment provided into CHC, PHC and hospital. Then facilities for the MTP at the health center and control of the respiratory tract infection and sexual transmitted disease. For control of that kind of the disease, that all care given to into that clinic, and the 2 lab technicians are available at district level. Then skilled manpower also needed for the whole kind of the care for mother and baby, and the disposable equipments also available into the PHC, CHC or subcenter level. Okay, so in addition, immunization program, then essential and immediate newborn care. In essential newborn care, which kind of care given to the particular newborn? That is the resuscitation, prevention of hypothermia, means controlling of the room temperature and baby temperature. Okay. Then prevention of infection, exclusive breastfeeding is given to the baby. Then referral for the sick newborn. If any case, emergency case, if newborn is very serious or major condition, that the particular doctor or particular center is referred to the another specialized doctor, and for the specific care given for the newborn. Okay. Then in diarrheal disease control program, safe drinking water, ORT, means ORS, zinc, all are provided for the prevention of the diarrhea. Then rotavirus is mainly affect for the diarrhea. Okay. So for disease control, we can provide the safe drinking water and ORS and zinc. Then acute respiratory disease control, in that cotrimoxazole and pneumonia disease, prevention of the vitamin A prophylaxis. Okay. So at 9 months, 1 international lakh unit, and at 16 months, 2 lakh unit is given. Then in every 6 months up to 5 years, this kind of the medicines and vaccination given to the mother and baby also. So in that phase 1, we already learned about the correction of the vitamin A prophylaxis, and not only that, but prevention and correction of the anemia also done, because due to the deficiency of the anemia, the highest risk of the baby may have, that is the neural tube defect. Okay. So in that case, we can provide the iron and folic acid supplementation to the mother. Then introduction of the hepatitis B vaccine to the mother, so that the prevention of the hepatitis we can learn, and training of the DIAS. Okay. So these all kind of the care are provided into the phase 1 of the RCH, reproductive child health. In phase 2, some topics are remain same, that is the reduction of the morbidity and mortality rate of the mother, infant, and but one special things are added, that is the under 5 children. Okay. So under 5 year of age children also included into the phase 2 of the RCH program. And promotion of the adolescents health and control of the respiratory tract infection and sexual transmitted disease also. So these two are added, that is the under 5 year of children, promotion of the adolescents health and control of the RTI and STDs. Okay. Then strategies for this phase 2, that is essential obstetric care given. In that 3 to 4 ANM staff available, nurses for the 24-hour delivery into the PSC, CSC and sub-center. Okay. Because delivery is the not only defined time. Okay. Any time will occur. So in that case, 3 to 4 ANM staff nurse always available into the 24-hour duty into the CSC and PSC sub-center. Then skill attendance at the birth. Okay. Then provision of the ANM staff nurses to use the drugs in emergency, because all kind of the drugs are prepared for the mother in the emergency purpose. Then emergency obstetric care also provided, that is first referral unit provided, normal and assisted delivery, and surgeries like the cesarean section. Okay. In that many risks are present for the mother and baby also. Assisted delivery, in that case a vacuum delivery, forceps delivery, cesarean section, all can given. So in that case, care of the newborn is very important, and emergency care of the sick newborn, family planning service including the laparoscopy. Okay. Then safe abortion service also provided. In these all kind of the care given into the particular emergency obstetric care. And treatment of the sexual transmitted disease and respiratory tract infection, blood storage facility always available into the CSC, PSC, because if a patient have an anemic problem. Okay. So or blood loss, or due to folic acid deficiency, in that case we have to provide the blood to the mother. So blood storage facility must needed. Then essential lab facility, then 2 lab technicians and referral transport service always available for the post referral unit and CHC PHC also. A new initiative for that 16 weeks training of the MBBS doctor in anesthetic skills. So particular doctors also provided the training for the this kind of the reproductive child health given and setting up of the blood storage facility at the post referral unit. So today we learn about the MCH care, RCH care, okay, and CSSM. MCH maternal child health, reproductive child health, and child survival and safe motherhood. Thank you.